Let us begin. It's time to talk about these drugs, man. We're talking about pharmacology and medication administration, to be more specific. And what about pharmacology and medication administration, you ask? Well, first is administering medications, because I'm skipping the introduction. No need. Administering medications. A medication, and that's in bold print, is generally defined as a drug or other substance that is used as a remedy for illness. What is a medication? It's a drug or substance that is used as a remedy for illness. What is a drug? A drug is a chemical substance that is used to treat or prevent a disease or condition. Closely related. The terms drug and medications are often used interchangeably by EMTs. The study of drugs is referred to as pharmacology. All right. The EMT must take seriously the responsibility of administering medications. Medications have specific physiological effects on the cells, organs, or body systems. When the correct dose is administered appropriately, the patient's condition may improve significantly and uncomfortable symptoms may be relieved. If administered inappropriately, some drugs can cause serious side effects and deterioration in the patient's condition. Don't want to do that. As an EMT, you will be administering medications under the direct order of a licensed physician. Without this order, you cannot administer any type of medication. Also, the EMT is only able to administer the medications identified in the local protocol. Y'all got that? The EMT is only able to administer the medications identified in the local protocol, which may include all or some of the medications covered in this chapter. Remember that you may not administer or assist with administration of any medication other than the medications that are identified in the local protocol. They said it twice. That made me, record it 3 times. Anyway, for example, they love examples. If you arrive on the scene and find a patient experiencing excruciating pain associated with a dislocated shoulder bone, and you find the patient's prescription of Percodan at his side, it would be inappropriate for you to suggest administer or assist with the administration of the medication. Why, you ask? Why? Shit, why not? He in pain. He's screaming. Even though Percodan is a pain reliever, it might seem to make sense to use it to make the patient more comfortable, it is not an acceptable medication to be administered by an EMT. It's not in your local protocol, y'all. An EMT can only administer medications within his scope of practice. Only! Some systems clearly distinguish between the EMT administering and assisting the patient with the administration of a medication. Administration of a medication implies that the EMT will actually take all of the steps necessary to give the patient the medication via an oral, injection, or inhalation route. The patient simply takes the direction from the EMT while receiving the medication. If the orders clearly state that the EMT will assist with the administration of the medication, the EMT will prepare the medication and then hand it over to the patient, who will then proceed with taking the medication. As an example, I just love these damn examples. If the orders state that the EMT can administer aspirin to the patient, the EMT will obtain the aspirin. Got that? Instruct the patient to chew the aspirin. Got that? And place it in his or her mouth. If the order, we got to pause that a little bit. If the orders only allow the EMT To assist with administration of the aspirin, the EMT will obtain the aspirin, instruct the patient to chew such said aspirin, hand the patient an aspirin tablet, and have the patient place it into their mouth. All right? Medications commonly administered by the EMT. Medications administered by the EMT are either carried on the EMS unit or are prescribed for the patient. The prescription medications may be found on the patient or at the scene. General steps for properly administering all of the medications mentioned in this section are detailed at the end of this chapter. Medications carried on the EMS unit. The following medications may be carried on the EMS unit. Even though the EMT controls the administration of these medications and they are ready at hand on the ambulance, an offline or online order from medical direction is still necessary. I'm going to say it again. Even though the EMT controls the administration of these medications and they are ready at hand on the ambulance, an offline or online order from medical direction is still necessary. You got it? Got it. All right. Oxygen. O2. Oxygen is an odorless, tasteless, colorless gas. It's a gas, all right? Oxygen is a gas. That's the only thing that makes sense there because we know it's odorless and tasteless and colorless because we're breathing this shit in, all right? But do remember that oxygen, O2, is a gas that is found in ambient atmosphere at a concentration of approximately 21%. When it is used for medical purposes, it is administered as a 100% compressed gas concentration. Oxygen is indicated in any patient who is experiencing a medical or trauma condition and who may be hypoxic or become hypoxic, because hypoxia is not your friend. Let's go back. It says here, when it is used for medical purposes, it is administered as a 100% compressed gas concentration. All right. And then, oxygen is indicated in any patient who is experiencing a medical or trauma condition and who may be hypoxic or become hypoxic without sufficient oxygen in the body. I'm explaining what hypoxia is. By increasing the oxygen concentration breathed in by the patient, you are attempting to put a higher concentration of oxygen into the alveoli of the lungs. By doing so, you will increase the amount of oxygen crossing over from the alveoli and into the pulmonary capillary. This will allow more oxygen molecules to be available to attach to the hemoglobin on the surface of the red blood cell. By increasing the number of oxygen molecules attached to the hemoglobin, more oxygen will circulate in the blood and be delivered to the hypoxic or potentially hypoxic cells. Oxygen was covered in detail, chapter 10, airway management. Oral glucose. Oral glucose. Glucose, what is glucose? It's a simple sugar that is found in the blood, no more, nothing less. It is the primary energy source for the body cells. Most cells throughout the body are capable of using other energy sources if they can't get enough glucose. Brain cells, however, Brain cells, however, can use only glucose for energy. Your brain uses only glucose for energy. Your brain uses only glucose for energy. It don't need nothing else. It don't need it to be broken down. It goes straight to the brain. All right? Your brain is selfish as fuck. So before the rest of the body gets it, the brain is like, send that sugar up here, bitch. Come on. When the brain cells do not get an adequate amount of glucose, they begin to function improperly, and the patient will exhibit an altered mental status. The signs and symptoms of low blood glucose, you ask, will appear very rapidly. If the level drops too low for a long period of time, the brain cells can actually die. You hear that? Wow, man. Wow. If the brain don't get enough sugar, man, the brain cells can actually die. You need the sugars, all right? So they say. What kind of sugars, you know? They're not saying that you need the white sugar in the bag, the processed shit. They're saying your brain needs the glucose, all right? So you can eat an apple, and that's what your brain needs. You got it? All right, let me have to make that clear. I mean, go eat some fucking donuts, because if I don't, I'm going to die. Oh, no. Oral glucose is administered to the patient with a history of diabetes who is suspected of having a low blood glucose level. The oral glucose is absorbed in the mouth and through the intestines and eventually into the blood, where it will raise the blood glucose level, making more glucose available to the starving brain cells. We're hungry. The brain cells will once again begin to function normally. This will be seen as an improvement in the mental status. Oral glucose will be covered in later detail in chapter Q, diabetic emergent. Anyway, so, before you listen to this or study, get yourself some glucose. All right? Put the processed shit down and eat some natural shit. Some good glucose. Get yourself some fruit or something. All right. Activated charcoal. Activated charcoal is a fine black powder that is designed to absorb or bind an ingested poison to the charcoal. Activated charcoal is a fine black powder that is designed to absorb or bind an ingested poison to the charcoal. Once this occurs, the poison will be carried by the charcoal through the digestive tract and then eliminated in a bowel movement. The efficacy of activated charcoal has been questioned. The effects of charcoal has been questioned. Activated charcoal has been removed from many protocols. Activated charcoal will be covered in detail in chapter 22. All right, aspirin. Activated charcoal is some good shit, man. Aspirin. Aspirin is administered to a patient who is having chest discomfort or pain that is related to the lack of oxygen getting to the heart. The administration of aspirin may keep the vessels that deliver blood to the heart, the coronary arteries, from completely closing shut. Medications prescribed for the patient. Some of the medications that the EMT may administer or assist the patient with administering are not carried on the EMS unit, of course. Instead, they are medications prescribed for the patient. Through good history taking, you should identify any medications the patient is currently taking, unless they're screaming out of fucking control. And remember that you may need to ask, some bystanders or family members. The patient typically will have the medication in his possession. However, it may be necessary for you to locate it at the scene. For example, you arrive on the scene and find a patient who is experiencing severe chest pain. During your assessment, you determine that the patient has a prescription for nitroglycerin tablets. The patient states that the tablets are upstairs next to the bed. It's upstairs next to the bed. You must remain with the patient while your partner, a family member, or a first responder retrieves the medication. Do not let the patient attempt to get the medication, of course, since the activity may increase the discomfort and aggravate the medical condition. Why would you let him do that? Come on, man. Shit, get for real. Whether the EMT actually administers the medication or assists the patient in administering the medication, it is up to medical direction and local protocol. The following are prescribed medications that EMTs may administer or assist in administering. Inhaled bronchodilator. Medications that cause the bronchioles to dilate are delivered via two different routes. A metered-dose inhaler, MDI, patients with asthma, or a small volume nebulizer, SVN, all right? Those two. A metered-dose inhaler, MDI. A metered-dose inhaler is used by a patient who has some type of respiratory disease. Most often, you will find MDIs prescribed to patients with a history of asthma, emphysema, or chronic bronchitis. These patients will have episodes of bronchoconstriction in which the bronchioles in the respiratory tract will constrict. Damn. Wait a second. Fucking myself up here. These patients will have episodes of bronchoconstriction in which the bronchioles in the respiratory tract will constrict, increasing the resistance to air flowing into the lungs and down into the alveoli. The patient will experience shortness of breath and signs and symptoms of respiratory difficulty, flow of oxygen to the alveoli. Did I skip a line? Difficulty from the increase of breathe and from decreased flow of oxygen to the alveoli. The only MDI that you are able to administer or assist the patient with is one that contains a beta-2 agonist drug. Well, let me say it again. The only MDI that you are able to administer or assist the patient with is one that contains a beta agonist 2 drug. My bad. Beta-2 agonist drug. Beta-2, that is. Because beta-2 dilates the bronchioles. That's what it is. All right? Beta-2 agonist drug. A beta-2 agonist drug, I just said this book. God, man, the book always trying to speak for me and shit. I said it. I'm ahead of the game. A beta-2 agonist drug will cause the bronchioles to dilate or open, increase in diameter, decreasing the airway resistance and increasing the airflow through the respiratory tract and into the alveoli. All right? Small volume nebulizer. SVN. The beta-2 specific medication administered via a metered dose inhaler can also be delivered through a small volume nebulizer, SVN. The indications, actions, side effects, and contraindications of the medication are the same. Only the route of delivery is different. Okay? So MDI, SVN, the indications, actions, side effects, and contraindications of the medications are exactly the same, all right? The only difference is the route. The route of delivery is different, all right? To nebulize a medication, you place it into a specialized chamber. I said specialized. Don't tell nobody. And pass oxygen or compressed air through it to create a fine vapor. The fine vapor is expelled through a T-tube and into a mouthpiece or mask. The patient then inhales the vapor through the mouthpiece or mask over a period of several minutes and until the medication is completely gone from the chamber. Note that an MDI is designed to deliver the medication with one inhalation, one of them things. No, it's, that's it, all right? My sound effect's a little off. Don't judge me. Whereas the nebulizer is designed to create a continuous flow of vapor that contains the medication. With each inhalation, the patient breathes in the beta-2 specific medication, which is then topically deposited in the bronchioles and at the site of bronchoconstriction, all right? So one takes a little longer. The SVN, there's a little bit more steps to it. The MDI, they press a button and it's on. All right. Some EMTs carry nebulizer equipment and beta-2 specific drugs for nebulization on the ambulance. Others are allowed to administer or assist the patient with administration of the beta-2 by using the patient's home nebulizer. Nitroglycerin. Nitro is a medication that is used to treat cardiac patients with diseases of the coronary arteries that deliver blood to the heart. All right. The medication is commonly referred to as nitro, or you might see NGC, I think? NGC. All right. Nitro, NGC, nitroglycerin. Nitroglycerin is a vasodilator. It dilates the vessels, all right? Nitroglycerin is a vasodilator. That is, it dilates the blood vessels in the body. I'm tired of the book trying to take my shine, man. I'm shining out here and shit, man. I already said it. I said it already. Nitroglycerin is a vasodilator. Right after that, what did I say? Y'all heard me? Shit. I said that it dilates the blood vessels. I don't need the book to say that shit for me. It dilates the blood vessels. That's what it does. Hence the term vasodilator. By doing so, it reduces the workload of the heart, thereby decreasing the demand for oxygen by the heart muscle. In addition, it dilates the coronary arteries themselves, which increases the supply of oxygenated blood to the heart muscle. All right. Because it is a vasodilator, the major side effect of the drug is hypotension, low blood pressure. Hypotension, why? Because it dilates the blood vessels. You got it? So that could cause hypotension in itself, low blood pressure. All right, because anyway, I ain't even got to explain that. I shouldn't have to. It is extremely important to measure the blood pressure prior to and after administration of nitroglycerin. Why? They just told you that okay, since it's a vasodilator, the major side effect of the drug is hypotension or low blood pressure. So why would it be extremely important to measure? I know they're about to tell us. I'm ahead of the game, though, baby. This book can't fuck with me. Why is it extremely important to measure the blood pressure prior to and after administration of nitroglycerin? Huh? I know you know the answer. That's what I'm talking about, man. You're doing the damn thing. You keep doing what you're doing, all right? You're going to be all right. You keep doing what you're doing. This shit real. Nitroglycerin must not be, well, let's see what the book has to say about it. I know you're right, but the book be hating on us. Nitroglycerin must not be administered. That is, it is contraindicated to patients taking medications for erectile dysfunction, which themselves lower blood pressure. In particular, patients who have taken tadalafil or Cialis, vardenafil or Levitra, or sildenafil, which is Viagra, should never be given nitroglycerin. The combined blood pressure lowering effects of the nitroglycerin and the erectile dysfunction medication may cause serious drops in blood pressure and perfusion and can lead to death. You got it? They just told us why. That's why. Because if they take that medication, which dilates their blood vessels as well, and then you give them the nitro, which further dilates the blood vessels, that's going to be low amount of blood pressure for them. It's going to drop it so low that they could die. You get it? That's it, All right. Epinephrine. I knew you already knew it. I'm just saying, we breaking shit down together. Epinephrine. Epinephrine is a drug used to treat patients suffering from severe allergic reactions known as anaphylaxis. An anaphylactic reaction usually occurs when the patient ingests, inhales, or absorbs a substance that the body views as foreign. That thing foreign. The body then reacts with a misdirected and exaggerated immune response. What causes that response? If y'all been listening to me, or if you've been reading on your own, what causes the exaggerated immune response? It's a mediator. I give you a clue. It's a mediator. What is that mediator name? It's one in particular. And he be jumping at the gym. That mediator is called histamine. Histamine, all right? Histamine. The body then reacts to the misdirected and exaggerated immune response that can easily lead to death, all right? The patient's blood vessels dilate, vasodilation, decreasing the blood pressure and perfusion. The bronchioles constrict, bronchoconstriction, increasing the airway resistance and making it difficult to move air into the alveoli. And the capillaries leak fluid out from increased capillary permeability, causing the blood volume to decrease. These all can produce serious signs and symptoms in the patient and lead to failure of the respiratory and cardiovascular systems. All right, so be careful with these damn administrations, man. Many patients with a history of anaphylactic reaction will carry an epinephrine auto-injector or an EpiPen. This is a pre-filled single-dose or multi-dose spring-loaded device that delivers a specific dose of epinephrine when activated. The epinephrine constricts the vessels, increasing the blood pressure, dilates the bronchioles, allowing the patient to move more air into the alveoli, and decreases capillary permeability, reducing the leakage of fluid. All right? Medication names. Let's talk about these names of these drugs. A medication or drug can have up to 4 different names. Lingo, get with it. Chemical, generic, trade, which is the brand, and official. These names are assigned during the development of the drug and are used interchangeably. The EMT must be most familiar with the generic and trade names. The EMT must be most familiar with the generic and trade names. That makes sense, right? Of course, you don't need to know the chemical makeup of the shit. Table, blah, 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 da, da. A description of the 4 drug names is as follows. Chemical name. The chemical name describes the drug's chemical structure. It is usually the first name associated with the drug. Generic name, also referred to as the non-proprietary name. The generic name still reflects the chemical characteristic of the drug, but in a shorter form than the full chemical name. It is the name assigned to the drug before it is officially listed and is independent of the manufacturer. The generic name is listed in the U.S. Pharmacopoeia, a publication listing all drugs officially approved by the U.S. Food and Drug Administration, USDA. Trade name. The trade name, also referred to as the brand name, is assigned when the drug is released for commercial distribution. The name is usually short and easy to recall, and may be based on the chemical name or the type of problem it is used to treat. This is the name the manufacturer uses to market the drug. The official name. Drugs meeting the requirements of the U.S. Pharmacopoeia or National Formulary are given an official name. It is commonly the generic name followed by the initials USP or NF. All right? That's how you know it's the official name if it has USP or NF at the end of it. It is commonly the generic name followed by the initials USP or NF. An example of the 4 drug names for the common nitroglycerin tablet. I ain't reading that. All right. Routes of administration. Let's talk about the routes. All right. The route describes how the medication is actually given or taken by the patient. The route that is chosen controls how fast the medication is absorbed by the body and its effect. Each medication administered by the EMT is prepared in a form that allows for the quickest and safest absorption into the body. The following are common routes of administration of medications given by the EMT. Sublingual. The medication is placed under the patient's tongue. Sublingual, that's exactly what that means, under the tongue, remember. All right? The patient does not swallow the medication. They don't swallow it. It is dissolved and absorbed across the mucous membrane in the mouth. The drug usually has a relatively quick absorption rate into the blood. The patient must be alert in order for you to administer the medication in this manner. Why? Because they can't hold it under their tongue if they're unconscious, all right? Medication placed into the mouth of a patient who is not alert or who is unresponsive can become lodged in the airway or aspirated into the lungs, and that's dangerous. Only a very limited number of medications are able to be given by the sublingual route. Medications administered by the EMT by the sublingual route or nitroglycerin tablets, nitroglycerin spray. It's that simple, people. Nitroglycerin tablets, nitroglycerin spray. That's it. All right. Oral. The drug is swallowed orally, all right, except for activated charcoal. Activated charcoal, it is absorbed from the stomach or intestinal tract. The patient must be responsive and able to swallow in order for them to have oral medication. Duh. The patient may refuse to swallow the drug if it is unpleasant or may vomit it. Aspirin is first chewed so that the medication absorption can begin immediately through the oral mucosa, and it is then swallowed. Medication administered by the EMT by the oral route are aspirin, oral glucose, and activated charcoal. Inhalation. The medication is prepared as a gas or aerosol and is inhaled by the patient. This method typically deposits the medication directly to the target site where the effect is needed most. The patient must be spontaneously breathing for this route to be effective, all right? With some medications, the patient must be responsive and breathing deeply enough to move air into the lower portions of the respiratory tract in order for the drug to be properly deposited. Medications administered by the EMT by inhalation route are oxygen. You got that? Did y'all hear that? I'm going to say that again. Medications Administered by the EMT by the inhalation route are oxygen, number one. You got that? Oxygen. Meter dose inhaler, MDI, or an SVN. What's an SVN? Small volume nebulizer. We said it at the same time. Yeah. Intramuscular injection. This is the last route of administration. Intramuscular, they threw that in front. It's injection, but of course they're saying you want to, inject the person in their muscles, All right. You don't want to do it directly in the bloodstream. Anyway, the drug is injected into a muscle mass. The absorption is relatively rapid. This requires the use of a needle. Therefore, it poses the danger of a needle stick injury to the EMT. Some discomfort is felt by the patient. Serious side effects might occur if the drug is accidentally injected into a vein. Did you hear that? That's why you're going straight to the muscle, not the bloodstream, all right? Serious side effects might occur if the drug is accidentally injected into a vein. The medication can only be injected into specific muscle groups. Medication administered by the EMT by the intramuscular injection route is, can you guess it? You know what it is. EpiPen, epinephrine with the use of an auto-injector. Medication forms. Let's talk about these different forms. Medications come in several different forms. The form usually limits administration to one specific route. This ensures the proper administration of the medication, its correct controlled release, and also the appropriate effect on the target organ or body system. The medication form also determines the effects of the drug. Some drugs have a more local effect on specific cells or organs, whereas other drugs have a much broader or systemic effect on the entire body. Common forms of medications administered by the EMT are. Common forms of medications administered by the EMT are. Common forms administered by Common forms of medications administered by the EMT are. That's what I get for trying to read that shit third time. Compressed powder or tablet. A compressed powder that is shaped into a small disc or elongated shape. Nitroglycerin tablets and aspirin tablets are examples of this type of medication form. Liquid for injection. A liquid substance with no particulate matter. A liquid substance with no particulate matter. Because epinephrine is injected into the muscle, it is in a liquid form. Gel. Gel. GEL, a viscous, thick and sticky substance that the patient swallows. Oral glucose is a gel. All right. Suspension. Drug particles that are mixed in a suitable liquid. These mixtures do not remain mixed for long periods of time and have a tendency to separate. Suspensions must be shaken well prior to administration. Activated charcoal is administered as a suspension. So when you think of suspension, think of something like juice or something, You got to shake it. Shake it up. Fine particle. Okay, my eyes playing tricks on me. Fine powder for inhalation. This form is actually a crystalline solid that is mixed with liquid to form a suspension. A prescribed meter dose inhaler, or MDI, carried by the patient for inhalation has medication in this form. Because it is a suspension, it is necessary to shake the canister vigorously prior to administration. The medication appears as a mist or aerosol. Each spray delivers a precise The medication appears as a mist or aerosol. Each spray delivers a precise measured amount of drug to the patient. All right, finally got that out. And we have a small volume nebulizer, SVN. A nebulizer. What is a nebulizer? It is a device that uses a compressed gas, typically oxygen, that is forced into a chamber containing medication. The gas mixes with the liquid medication and forms an aerosol. The aerosol is inhaled by the patient either through a mouthpiece or through a face mask, and the medication is directly deposited on the mucosal lining deep in the respiratory tract. By depositing the medication at the desired site, the effect is more immediate and direct than when given by other routes. And fewer systemic side effects are usually noted. You heard that? Fewer side effects are noted with the SVN. The medication comes packaged in a pre-measured and pre-mixed fixed dose container or inhaler. Gas. Oxygen is the medication most commonly administered by EMTs, and oxygen is a gas. It is inhaled and has systemic effects on the cells and organs. Spray. The last form is a spray. Spray droplets may be deposited under the tongue. Nitroglycerin, often in tablet form, may instead be in the form of a spray. Nitroglycerin spray is an aerosol that contains nitroglycerin in a propellant. Each spray delivers a precise metered dose. Essential medication information. Essential medication info. It is important that the EMT understand the following terminology associated with the medications to be administered. Indications, contraindications, dose, administration, actions, side effects side effects. Okay. We will use the example of nitroglycerin so you can see how the information applies to a medication you will actually be called upon to administer. This information is essential to ensure proper, safe, and effective medication administration. Indications. The indications for a medication include the most common uses of the drug in treating a specific condition. Indications are geared toward the relief of signs, symptoms, or specific conditions. A direct therapeutic benefit derived from the administration of the drug. For example, an indication for the use of nitroglycerin would be chest pain, because nitroglycerin may relieve chest pain. Got it. Contraindications. Contraindications are situations in which the drug should not be administered because of the potential harm that could be caused to the patient. In some cases, the drug may not have any benefit to the patient in improving his or her condition. Therefore, the drug should not be given. Low blood pressure is a contraindication for the use of nitroglycerin, because nitroglycerin will lower the blood pressure, possibly causing an already low blood pressure to become dangerously low.